Hi everybody, Mrs. Davenport. This feels so strange making videos, but since I made you all do a video, I'll make one for you too. So this video is going to be going over the eye and ear procedures for the eye and ear installations and eye and ear irrigations. So we'll start with our patient here, Jane, first. Because we had to give her a name. We're going to use her because she has got really good eyes. A little backstory I like to tell about her while we get set up is that Jane works for a construction company. She's one of those people that that holds the signs. So she's got some dirt in one of her eyes. She's got dirt in her left eye. So what we're going to do is first put a few little drops in her eye to help soothe it. And then the physician wants us to then, after we do that, to flush her eye or do an irrigation. So we'll get set up. And what we need for this procedure would be gloves for myself, because I want to protect my patient while I'm doing these procedures. We want to use non-powdered gloves so that when I am around her face and touch her eye, that I don't get any powder in her eye, which would just compound the issue and make it worse for her. I also have a chuck for when we do the irrigation that we'll do afterwards. This chuck it's an absorbent underpad, and when we put that on our patient, it will help to prevent any spillage of water or any water getting on her clothing. We also will have a little basin. This is an emesis basin, and that will be to what the patient will have the patient hold under her nose and under her cheek. So then we'll have her tilting towards her affected side, and then ideally all of the fluid, when we flush it through her eye, will come out of here and fall down into the basin and hopefully not get too much on her clothing. All right. So we also have another container. In this container, I'll have very hot water, at least to 98.6 degrees. And then we have our normal saline that we want to place in here. And just kind of like a baby bottle, you put it into warm water and allow it to heat up. So as we're getting prepared for the irrigation, we want this to be warming up so that it is at least body temperature before we start flushing her eye with it. For the installations, we're going to be using these artificial tears. And then we are also going to, just for demonstration, use these gentle tears. You want to make sure that when you're looking at your labels, that anything pertaining to the eye will say optic, or specifically will say for the eye. You have to look for at least the first two letters on what this is used for is OP. And you know that that will be safe to use on the patient's eye. For the irrigation, we'll also use this bulb syringe. This is also one of those syringes that you may have seen used on one of your younger siblings or a cousin or something. We'll squish all the air out and then suck up as much fluid as we can and then flush her eye with this. This has never been used on a baby's nose, okay? And then we also have either some cotton balls or some little cotton balls or some gauze pads. All right, so we will go ahead and get our gloves on. Hi Jane, my name is Bonnie. I'm going to be doing putting some drops in your eyes that the doctor wants us to do, and then we'll also going to flush your eye out. Okay, are you all ready for that? And then of course you can have the patient talking to you. The first thing that I want to do for my patient is to wipe her eye. When you wipe your patient's eye, you want to, and I'll turn her so she's looking at you, where the upper and lower lid meet on the inside and where the upper and lower lid meet on the outside, these two little spots are called the canthus. Okay, canthus. You want to wipe from inner to outer canthus. always. And anytime you wipe an eye, you always want to go, oops, or she's gonna lose her hair. You wanna go from inner to outer canthus, okay? This will prevent any cross-contamination. When we're putting in ointment or drops into her eye, we always want her to be facing the affected side so that nothing drips down. If there's any drippage, it doesn't drip down and get into the unaffected eye, okay? So you also want to maybe hold or rotate your medication a little bit for your patient so it's nice and warm, because remember, her body temperature is 98.6. If we did this and we say at room temperature, the room is like 70 something degrees, and that's just a little bit too cold. When you take the cap off, you always want to place it cap up on the counter or wherever you're placing it. You don't want to place it cap down, because if this is a sterile bottle and I place this cap that is also sterile on top of the surface, it's not going to be sterile anymore. Therefore, when you put the cap on, it's not sterile at all either, okay? So you're going to get a new piece of gauze, and you're going to pull her lower lid down, and that is going to pull her lower lid down like this to create that little pocket. That's called the conjunctival sac. The conjunctival sac, okay? You want your patient to look up and keep her eyes open as much as possible. And you're gonna take this, I would possibly be on the same side of the patient doing this, but for you guys able to see. If you have to lean over the patient for any reason, you want to be very aware and conscious of where your body is so that you're not laying on the patient, okay? So pull that lower lid down, create that conjunctival sac, and we're just going to put 1, 2 drops right in that conjunctival sac. If there's any leakage, go ahead and catch that. Have your patient close her eye. She'll need to leave it closed for, I don't know, 30 seconds, a minute. While she has her eye closed, you want her to tell her to move her eyeball around a little bit, just to kind of help disperse the medication that's in her eye. Her eye will be blurry, her vision will be blurry at first, especially more with the ointment than with the drops, because the ointment is oilier than the drops are. And also with your bottle, when you take it out of the cabinet, you want to read the label, make sure that it is what the doctor has prescribed and it's what the medication that you want. And you also want to check for expiration dates. So this is at the bottom of the bottle, and hopefully you can see that it expires in 2022. So we're good to use it. Excuse me, patient, I didn't mean to lean on you like that. But you're gonna check your label 3 times. We're checking it when we take it out of the cabinet, we're taking it before we use it on our patient, and we're taking and looking at checking the label after we use it on our patient. We're getting ready to put it away to make sure that it is in fact what we want it to be using. All right. So the next one I'll show you is this ointment. This is the Gentile ointment. Okay. Same thing, you're going to cleanse her eye before you put the ointment in. You're going to wipe from inner canthus to outer canthus. You don't have to be putting a lot of pressure. Remember that our eyes are sensitive, so you don't want to really be pressing there. You're just gently wiping from inner canthus to outer canthus to remove any debris or any exudate, any discharge, anything from the eye. Okay? Cap up, or at least on its side. If you squeeze this tube just a little bit, you can see that there's a tiny bit of some ointment coming out. That's what's going in the patient's eye. And where we're going is right along the lower lid of the patient, and we're again going to pull it down to create that conjunctival sac, and then we're doing just a little ribbon of ointment in the patient's eye, making sure, and then let go, they're going to close their eye. But let me come over. and show you. What we want to make sure is that we haven't touched the lid of the patient with the tip of the ointment, and we've also not scratched the cornea, okay? So that's a little better picture of what it looks like, okay? So once she's closed her eyes, she's gonna leave it closed for about a minute again, not blinking, and tell her not to pinch her eye together, not squint her eyes together. She just wants to close it gently and roll the eyeball around on the inside until, you know, for about 30 seconds to a minute. When she opens her eyes, it's going to be very blurry because an ointment is very thick and oily. So it's going to cause her vision to be very disrupted for a short time. So just because I don't want her to get all gucked up, I'm going to clean it out. But when she does open her eye, you can, you know, if there's anything that has maybe leaked out, you can wipe that out for her, okay? So that was the installation. Our next thing that we'll do for our patient will be the irrigation. So we'll put this, hello Jane. So doctor wants us to flush your eye out now. Actually, you know what? She should have been laying the other way towards the unaffected side. This was the affected side. I'm so silly sometimes. Now for the irrigation, it's the affected side. I'm so sorry. Unaffected for the drops, or actually she could just be looking up. For the irrigation, she needs to be towards the affected side, okay? So again, I have my basin with my sterile water soaking in very hot water, up to 98.6 degrees. We're going to have her place this right here on her cheek so she can hold it. And so we'll simulate that she's holding that. Once the water is at the right temperature, I'll take the cap off so it's ready to use. Again, I'm going to wipe her eye from inner canthus to outer canthus just to remove any debris, any makeup, any dirt or whatever might be there. Okay, inner canthus to outer canthus. This time, I'm going to plunge it to get the air out, and I'm going to put this in my water, and I'm going to get some of the water in here. Hold this up. I'm going to reach around behind the patient so I can open her eye, okay? Yeah, like that. The reason we want to try to open her eye, hold her eye open, is because if I just hold the lower lid open, you'll still be able to close your upper lid. And then when I go to flush the water, it's gonna go all over the place. If I just hold the upper lid open, the same thing, she's gonna be able to close her lower lid and the water is still gonna go everywhere, okay? So even if we tell them, don't close your eye, don't close your eye, it still is a natural reaction for us when something comes into our eye that we close it immediately, okay? So hold the eye open, just like that. She's holding this. We have our little bulb syringe. We're gonna start at the inner canthus and with a type of a sweeping motion. So we're squeezing and sweeping at the same time, okay? 2, and then we'll do it 3 times, catching all of the fluid in here, hopefully. And then, okay, Jane, how are you feeling? We can come around, kind of dry her face. You want to flush a minimum of 3 times, okay? And then you're gonna look in your basin and see if you can see any debris, any sand, any dirt, anything that may have come from out of her eye. You want to look in here. If she says that her eye is still bothering her, then you could certainly flush it a couple more times and make sure that you tell the physician or let the physician know that, that you did that and what you got and how the patient handled it. For both of these things, you have to chart. You have to chart down the exact medication that you used and how much of it you used and which eye you did it on, which eye you put the medication in, and how the patient tolerated it. on all of those. And that's for the installation. For irrigation, you're going to also note which eye you treated, what you used, and how the patient tolerated it. Once you're all done with the patient, you can dry her up, so nice, and then she can go. All right. So that is it for the installations and irrigations for the eye.